We are in the final moments. We've got one short topic, and then we will be out there. So one thing to note, we got security everywhere to make sure you're safe out there. This is a really cool spot, right? So if you want to get back there, you got to have your backstage pass, a.k.a. your lanyard, all right? Because this just isn't free to everybody in Santa Monica tonight. Only you and me and us, we get to go. So make sure you have your lanyard. We're going to go right from here, the front door, okay? So you go through the front door for the grand entrance. We made it really special, okay? And it's going to be over the top. I think I'm really excited. I'm excited for tonight. Now, tomorrow morning, we've got the Godfather of Light kicking us off. It's going to be exceptional. Breakfast at 8. We start promptly at 9. And we're going to do a little raffle for a treatment from Patrick Bitter Jr. tomorrow. What do you guys think? Yeah! Everybody loves the Godfather of Light, and flash, flash, flash. You will experience that. So for our final topic, and I know once this thing is over, we're going to be racing for the food and the open bar. But for the final topic, let's welcome the legend up, Jay Burns, to take us away. And then the first day's on wax. You know what to do, brother. Crush.
So a little Texas, I like that. Thank you. So it's always a bad position to be the only thing between you and happy hour, but I guess I'll do this. Hey, so what we normally do is I've got some things going on back in Dallas, and I've got to get back to a fundraiser in mentioning my mom tomorrow, so I have to leave. Otherwise, I would be here. But I usually follow Doug Caro with the Clear V and that kind of thing, and so he talks about the Clear V, and so then I kind of follow up just because not a lot of people use the YAG, and so I use the YAG a lot over my career, and I think Robbie likes for me to just talk about my history with the YAG. So what I'm going to say is just give you ideas about how you can use it. I don't know that it applies to everybody in the room, but I wrote an article I would reference for you guys if you're interested in it all. I think of all the articles I wrote, probably it's my favorite, but it's 2009 as a pediatric supplement in PRNS, and it was about how I used the YAG. And actually, those settings might be helpful for you because I think the settings that you use for the new laser, the Clear V, they're a little more conservative than what I use sometimes. And so what I did is I kind of walked through that in the article. It was one of the few things that I've written where I just went, okay, so you start with 80 joules, 50 millisecond pulse width. If that doesn't work, do you change the millisecond or the power or whatever? And I walk through all of that for you. And so this is really just kind of how I've embraced lasers over the years. It may not have a great applicability, but it was my life for a long time. So the reason I did it is because, as I told you, I've been blessed my whole career. And so what happened was I did a fellowship in vascular anomalies at Harvard. And so the guru of that was a guy named John Mulliken, but he didn't believe in lasers. So I had to kind of learn lasers because I realized that you didn't tell him what to do. You just kind of went and learned it. And so I came back and started the second clinic in the country on vascular anomalies. And as in my later career, 95% of all the letters from my patients are my kids who've grown up and gone to medical school. I got one last week from a woman that I'll tell you how old I am. Is that they sent me this picture. She came by the office and said, "Hey, I'm really so happy. She had this giant hemangioma, and we took care of it, and this, that, and the other." And she said, and so I was looking at the picture, and I was looking at these kids that were probably 8 and 11, and I was looking, and I was going, God dang, I can't see. I mean, I'm good. I mean, I don't see any hemangioma. I can't remember who she is. It was the mom. I mean, the mom was, it was crazy. So anyway, it's been a great part of my practice, and so part of that helped me learn how to use the YAG. So what I'm just trying to tell you is a little bit about how I've used the YAG, and then tomorrow Doug is going to tell you how he can enhance the use of the YAG with the yellow and the orange light, and where you can enhance the blood vessel and trace those out. And we use it a lot in our practice now. I think it's a kinder, gentler, it's got cooling. It's really a great laser. So it's a very similar laser to what's been available, because I use the laser from Cyton for many, many years, and you can just dial it in with any kind of spot size. I take that back, 4 and 6 millimeter spot size, but any kind of pulse width, any kind of energy. It's a fantastic laser, and now they've just added to that. So really, I'd love for Doug to have talked before this, but Dr. Abraham's going to talk tomorrow about the Clear V. And so this is a lady. What I would tell you is, we were talking earlier, and I think Grant and Patrick were talking about treating BBL around the eyes. Well, let me just tell you, treating 1064, it's a very rewarding thing around the eyes, but I'm telling you, this is one of those places where I say, stop, you better be careful, because this is the kind of laser that will absolutely cause retinal damage. I know of one of the most renowned KOLs in the world that has a blind spot because of a 1064 that bounced off the roof of her orbit and hit her retina. And so, so the way I treat these is that I take the 1064, I use 80 joules, 50 millisecond spot size, 6 millimeter spot size, 50 millisecond pulse width. I've done that so many times that is my go-to almost 100% of the time. It's more aggressive than what the Clear V default settings are. But so many of my patients want these blue vessels all around their eyes gone. And so the way I treat those is, I actually will always, we talked about eye shields, but I don't treat anything with a YAG unless you put eye shields in the orbit. Now, one of the things that I would tell you is, the only thing worse than not having eye protection is having eye protection in and thinking you've got eye protection when you really don't. So the eye shields, if you're going to use them, I do not like the eye shields that are easy to put in and out with the little handle on them, because when they move to the side, that handle's just enough to have them go out to the side, and I don't like, if the eye shield is easy to put in, Grant's right, you've got to be very careful about putting them in, but I'm just telling you, most people will put in too small of an eye shield, and it'll come over just enough to let the laser in the visible light source go through your freaking iris, and it's just not something good. So if you protect the eye and you pull the skin up, I never use the YAG inside the orbital rim. So you've got to be able to put I don't care if the YAG, I never treat with a YAG inside the orbital rim. I don't care if the vessel's in there or not. It's not worth it. What are we doing, right? It's a freaking vessel. Tell the woman to get over it, right? And so, and not about women. It could be a man. I'm sorry. I'm not that bad of a guy. But when you actually treat this lady, I treated her. I made her skin look 25 years younger with resurfacing, but she was just super pumped about getting all these vessels out. And so she was 80 years old, so I was able to get those vessels way outside over the orbital rim and get them up where you could treat them. And they just, and if I want to get a resident really excited about using lasers, treating these with one way, you treat with one vessel. If you're treating these vessels, you can treat with one way, but you don't know exactly how the veins are moving. If you don't get it one way and you use the right settings, actually start at the other end and go the opposite way. And if you get it right, those vessels will just evaporate in front of your eyes. It's super fun. I'm getting some people going, yes, it's really fun. So that's what we do with that. So I just want to show you, my history of treating kids, and this is how I learned to do it, that now I showed you the cosmetic application, but I don't know if anybody in here, this would probably be more of a physician extender kind of thing, but I ran this clinic for such a long time that I just wanted to show you that the YAG will penetrate a good centimeter more than any vessel like a pulse dye or KTP or anything in the visible light source, and it'll penetrate. And so not only will it get, the hemangioma has gone away and we're left with this, and I can trace out these vessels, but I treated the whole vessel with the YAG because look at the volume reduction you can get with the YAG as well. And this is a lady, this is someone where, a pulse dye laser or a BBL could be treated, but sometimes they're resistant. And so again, treating this hemangioma with the YAG not only hit the mark, and it's very, very good. The YAG does not see color well. We did a study a long time ago, treated people with tans, not just dark skin, but with tans, and we didn't find any issue. The YAG will not really see dark pigment, so you can treat it in people that have ethnic skin. And again, I want to show you that it's so deep. Not only will you get the red part, but you also shrink the whole volume of that lip, which helps. I used to say that my kid, I'd be the only one that could say it. It's kind of like I could give my brother a lot of trouble, but if you mess with my brother, I'm going to hurt you, right? So I would just say my kids, they say, what do you do for a living? And I can't explain it. I'd say my clinic for years and years in the pediatric part, so I was that for a long time before I became purely cosmetic as I got old and tired. And but my clinic looked like a Star Wars bar. These kids were just bizarre. You never see these kids. And I don't mean that in a bad way. It was just, I love these kids. But it was, you don't see these kids in public. So this is a girl that came up from Mexico. And again, what we did is we treated her with the YAG just to help. You can see all those wrinkles in her chin, and just, you can't really appreciate it as much, but we can drastically, just with the YAG, decrease the volume of all that blood vessels, you know, in her skin and really improve that. It's a very powerful thing. Same way for a girl like this. A child like this, a 1064, will shrink that so we can actually do surgery afterwards. This is a you can treat this. Patrick was talking about treating. This is not a venous lake, okay? A venous lake is a dilated vessel as you get older, because it's kind of like getting a bleb in your tire, okay? That's what a venous lake is. A vessel gets dilated. This is actually a venous malformation, a congenital venous malformation, because this kid is about 16 years old, and her father owns one of the major sports teams in Dallas, and I had got a 1064. This is the first venous malformation like that. I'd never treated one in the lip ever, and I said it should work. And so as my sphincter was opening garage doors on the way to practice, I treated her with a 1064, and it was like a home run. And so I got tickets to the game and the whole deal. And she came back 18 years later with a recurrence, which you would expect with a venous malformation. You're shrinking it down, and I just touched that up with a 1064, and they work really well. Now, Patrick was saying you can use it with a BBL, with a small circular spot size, and it makes sense because you're in that infrared. I really haven't done that much because I really love the 1064 for these venous lakes, for the venous malformations, if you have that. And this is a kid, again, you can't do this with anything else. You could treat that all day with a pulse style laser, a KTP, but the 1064 will really not only help the red, and it will help the volume. So if you see this in any of your patients, there's some applicability. I just saw some crazy things, venous malformations that we can help. There's just no other way to help this other than, you know, surgical would cause a big scar. So the venous malformations, this is something called a glomus tumor. Again, I'm just showing you the value. This is a very, very painful. This guy, you couldn't even touch his arm. And so glomus tumors have nerves associated with every one of those vessels. So the vessels are not changed traumatically, but we reduce that, and the guy could live a life and put a shirt on for the first time without pain. So you can see the difference in his arms, and so we treated that. This is kind of a closing case, and just to show you all the things that they did in our clinic. And this is a child, this is probably one of the most amazing, probably the case I'll remember, one of the top 5 in my life, is this kid came in and he had a venous malformation of his upper lip. And when he came in, he had a bandana over his face. He wouldn't have anybody see it. He wouldn't talk. He had been bullied his whole life. It was crazy. So the cool part about being a surgeon and a laser surgeon is you can come in, and so you devise a case where we had to go in. It bleeds like crazy, right? So we had to put these pledgets around it, and then we devised a case by matching his normal lip and seeing how much lip we would have to resect to actually bring that lip up, and then get as much out with surgery and laser to improve on that. But we really didn't have the YAG laser at the time. But now you can see down here at the bottom, after we resect that, then we take the pledgets out and close it. He came in like that. And so all you need now is a what I say to this, if I just had a YAG, I could actually have gotten him across the finish line. I didn't have a YAG at that time. But the coolest thing was when he came in, that picture says it all, because when he came back in after the surgery, he didn't have a bandana. He jumped on the bed. It was just fantastic. So anyway, you know, there was a time, I tell people, they call me, there was a time I was actually a real doctor and I did some really important stuff. So it was fun. But I think the YAG, I say this, I think they just wanted me to tell you about that because I treated a lot of vascular malformations. These will apply to leg veins and all of that. And then Sharif tomorrow will tell you about how to use a YAG that's even better than the one I used. But it is a powerful tool. It's a very niche tool. But I think that the other, I want to make sure I'm saying the right thing. The clear silk is the scanning pattern, and I think that actually has a real role in rejuvenating some skin and getting some problem pigment. And you're going to hear that from Sharif tomorrow. But Robbie wanted me to just share that experience with you. I think it's probably a little bit out of the fairway for most of you, but I just do what he tells me to do. So anyway, thanks. Now we can go to happy hour. There you go.
So I love that, Jay. Thank you for sharing that.
Yeah.
Because, you know, what Sci-Town we're all about is we're about making lives better. A lot of it may seem fluffy, superficial, but there's a real substance and a depth to it. And we take this stuff seriously. And we take you seriously.